Hi, have you been diagnosed with something called as Addison's disease and wondering what it is? Now, Addison's disease is a condition where steroid hormones, namely corticosteroids and certain other hormones that are produced from the adrenal glands, are not being produced in adequate amounts in the body. Now, where are these adrenal glands? These adrenal glands are tiny little glands that are present just above the kidney, very small glands. They produce certain very important hormones. The number one hormone that it produces is something called as cortisol. Now, cortisol is a hormone which maintains the body's blood pressure and composure, especially during the periods of stress. It also produces certain hormones called as aldosterone, which is necessary for maintenance of the blood pressure throughout the day. It also produces a hormone called as adrenaline or adrenaline. So the adrenaline also comes from the adrenal glands. Now, there are certain conditions where the adrenal glands don't function properly. The number one reason for Addison's disease is autoimmune. Autoimmune means there is some genetic problem in the body. There is a problem in the gene that was there at birth time only, which has manifested at one particular age. Because of that, what happens is over a period of time, cortisol levels and other hormones that are produced from the adrenal glands, they start coming down. The other common causes for Addison's disease are in a person who has suffered from tuberculosis. Tuberculosis, as you know, is not a condition which affects only the lungs, is it not? It also affects certain other areas of the body. One of them can be the adrenal glands. There are certain tumors like lymphoma. There are certain severe septicemias with certain bacteria which also cause this particular condition. Another cause which is not directly related to adrenal glands but is related to the master gland, that is pituitary gland, can also cause Addison's disease. So if there is some bleeding within the pituitary or the pituitary is not functioning because of some growth over there, that can also directly affect the adrenal gland and cause Addison's disease. What are the symptoms of Addison's disease? Addison's disease mainly presents with number one, severe fatigue, weakness. So if a person is having a lot of weakness, this could be one of the symptoms, especially if it is associated with frequent low BP episodes. A person who's having continuously low BP and having fainting because of low BP and having extreme fatigue, we must think of Addison's disease as one of the possible causes. A common symptom that people talk about Addison's disease is a lot of gastric issue. They will have a lot of nausea. They might vomit frequently along with having weakness and having low BP as well. Please suspect Addison's disease in those cases. Not in pituitary cases, but in those cases which are affecting the adrenal glands, the skin color also starts becoming very dark. So people start becoming darker in color, especially if they are having hurt somewhere. Their scars will start becoming darker and blacker in color. So if that is also happening, we must think about Addison's disease, one of the possible causes. So a person who is becoming weak, is losing weight, is having low BP, is having frequent nausea, vomiting, and especially if his scars, etc. are becoming dark in color, we suspect Addison's disease. Now, how to treat this Addison's disease? It is the same as in all endocrinology illnesses. If a particular hormone is not being produced properly in the body, we have to supplement it from outside. Just like how we give thyroid supplements for hypothyroidism, testosterone supplementation for sex problems or hypogonadism, we do have to give cortisol supplementation in these cases. There are 2 or 3 ways of giving this cortisol supplementation. One of them is a natural way of giving. One of them is not a natural way but a cheaper way of giving, and we do replace cortisol. Replacement of cortisol can cause dramatic improvement in Addison's disease symptoms, and patients usually resolve very quickly. So if you are having any of these symptoms or you have been diagnosed with Addison's disease, it's important to meet up with an endocrinologist, a person who is trained for so many years in managing Addison's disease. So please consult an endocrinologist if you have been diagnosed with Addison's disease or have any of these symptoms that we have just spoken about. Thank you.